Okay, and your best behavior now. You're a medical doctor?
Yes, I'm an MD.
And you've had a fine practice for many years and been unable to practice because of so much pain yourself.
So much pain and disability, and also a worsening of vertigo that made it impossible for me to focus or concentrate on what I was doing. The combination of the pain and the vertigo led me to go on disability.
Oh.
So after 20 years of practicing medicine, I had to give it all up.
Now I just beat you like a bastard stepchild, and the last thing we did was your neck. What happened for you when you got up off the table?
So the first thing I noticed, and strangely enough, my sinuses had cleared, which had been stuffy throughout. But also when I got up off the table, I didn't have the vertigo or the dizziness that has been plaguing me for a while. And that was told to me it was due to a brainstem lesion as opposed to the normal inner ear thing.
And what we are seemingly discovering that is actually neither of those. It was pressure on the carotid sinus affecting the blood supply when the scalene muscles were tightening down. That's what it appears to be, based on the fact that the vertigo seems to have diminished so much or disappeared. What about the knees? Now, when you came in on that cane that's behind you.
Yeah.
And how's your walking now? And you're also standing up straight. You were hunched over before we worked on your back.
Yeah, I was hunched over, kind of like this most of the time. And as far as walking, I had severe pain in the left knee and also in the right, which was deteriorating because of all the weight it was bearing.
And how about now?
Now they feel good. There's no pain.
And how many years have you had the pain in the back and the neck?
Well,
I mean in the knees.
Probably about 20 in the knees and maybe 40 in the back.
Okay, and this is just one treatment, one extended treatment.
Yeah, and it's made a huge difference already.
Now, who screamed more during the treatment, you or me?
Well, I think it was you.
That's right, I did. And what I called it singing. And I think you said, don't quit your day job.
Yeah.
And that's when I stopped the treatment. I was done with you. So you came all the way from Omaha.
Yeah.
And what do you think? You made a long trip. What's the scoop, Snoop?
I was excited about the idea of being pain-free and being able to get off pain medicine, and I think you've done that for me. And I'm excited about the results. I want to learn this myself, because my whole goal in life was to treat pain and get people pain-free.
And is this a shocking result by medical standards?
By medical standards, it would not be doable, or if we did it, it would probably be injections and they last 2 or 3 days.
Okay.
By numbing the area and relieving inflammation, but to have it last a prolonged amount of time is not what we usually expect.
Now, is your plan actually to learn the techniques and kill me and take over?
No, I'd like to learn the techniques and honor you for creating them.
Holy key rap. I like avocados and sunsets and walks along the shore. So we're pretty darn good shape, huh?
I think so.
All right, I think we're done for now. You're saying you came here and...
Well, I made the trip hoping that I would get the results that some of the other patients had talked about on the videos. And like anything, you can get good or bad results, but these are nothing short of amazing that Tom was able to do for me.
So we got a couple other things to work on you, and we have a follow-up visit in a few days.
Yeah.
So we'll tidy up anything that seems to still be left, and then we're going to get to work on the shoulders and arms and all that kind of stuff, so you can go back to Omaha and beat people up like I'm doing. We're going to have to form a gang. I'm not sure what we're going to call ourselves. Something benign like the Buddha Boys. And that'll look good with the Buddha Girls. Here we go.